Am I audible?
Yes, sir.
Shall we start now?
Sure, sir.
Okay.
Yeah, you are audible, sir. You can start. Welcome.
Namami Dhanvantarimaadidevam Surasurairvanditpatpam Loke Zararubhayam Mrityunasham Dataramesham Vividoshadinam. So it is a great privilege for me to be here. So for this, I would like to say thanks, Vishwarit Parishad National Executive Committee, Professor Dr. Govind Shuklaji, Professor Dr. Mahesh Vyasji, Professor Yogesh Mishraji, Professor Anil Shuklaji. I would also like to thanks Rachna Shri Sambhasha team, Vaidya Rakesh Sharma ji, Vaidya Namrata Tiwari ji, Vaidya Sachin Kedikar ji, and Vaidya Amol Deshpande ji. And I would also like say thanks to uh, our today's session's guest who have leave now, Dr. Naresh Bhargavaji, Registrar Shri Krishna Ayush University. Thanks to all of you and thanks to participants who are listening me. So now come to today's topic. Uh, can I take some time to share my PPT? Okay. Is it visible?
Yes, sir.
Okay. So now come to the today's topic. It is plastination, an innovative technique of tissue preservation. As we all know that necessity is a mother of invention. So I put this the necessity of long-term hazardless tissue preservation is the mother of plastination. Basically, plastination is a preservation technique. So the preservation is a process to keep something safe from harms, destruction, and decomposition. Need of preservation.
Sir, your PPT is not visible. PPT is not visible. Only screen is visible.
If it is not visible,
No, only it is showing WhatsApp and Microsoft Bing.
एक्चुअली आपने गूगल वो खोल लिया है, विंडो जो खोली है आपने शायद उसकी खोल ली है। जो गूगल क्रोम है ना वो विंडो खुली है। विंडो में वो पीपीटी वाली विंडो सेलेक्ट करना पड़ेगा आपको।
okay. Now is it visible?
Yes, sir.
Is it visible now?
Now PPT is visible. Yes. Full screen. Full
Thank you.
screen करना.
Okay, thank you. Sorry for interruption. So the need of preservation, as we all know, for teaching and training purpose, research purpose, for medical legal purpose, in evidences, and for comparison, healthy and unhealthy tissues. Lots of examples are scattered in body preservation in ancient eras. There are of two types: wet type of preservation and dry type of preservation. So maximum time we will find wet preservation, but in Egypt we can find an example of mummification as a dry type of preservation. And underwater preservation explained by Acharya Sushrut, body preservation of King Dashrath in medicated oil, and Alexander, the Persian king. These are the examples for wet type of body preservation in ancient time. This is the process of preservation and dissection according to Acharya Sushruta and plastination technique in ancient time. Preservation basically are of four types: cryopreservation, desiccation, body embalming, and plastination. Basically, we are using body embalming and plastination in our institution for teaching and training purpose. What is plastination? Plastination is a cutting edge technique for the long term preservation of biological tissues. As I have said, that long and hazardous.
हेलो सर, आपका पीपीटी चेंज नहीं हो रहा है. Make it full screen, sir.
Is it changing now? Is it changing now?
PPT is on. What is Plastination? PPT is on.
What
It's
is
not full screen, sir.
Okay, yes.
स्क्रीन
This
मत
is
कीजिए, सिर्फ चेंज कीजिए, क्योंकि कभी होता है फिर वो कनेक्शन का एरर होता है.
okay. So, what is the plastination? Plastination is a cutting edge technique for long term preservation of biological tissues with visible surface and high durability. This technique have the formation of dry specimen that have 3D qualities. It means specimen have dried, deodorized, and durable. Basically, in the medical colleges or Ayurvedic colleges, we are facing two type of specimens. Some are wet type and some are dry type of specimens. But in the case of wet specimen, mostly we are using formaldehyde, and this chemical have some toxic effects like serious eye irritation, cancer, allergies, skin allergies, respiratory irritations. So we have to careful about that, and without careful condition we can get harms. Some specimens, after taking long time preservation in formaldehyde create blackness according to the due to the acetone formaldehyde hematine pigment. Formaldehyde also create white precipitation due to the formation of paraformaldehyde. So in wet preservation, it has to need to replace every 3 to 6 months. So these are the basic problems related to wet specimen. Some generals you can see here on the slide also shows the hazardous effect of formaldehyde. So plastination is a future technique of long-term tissue preservation. As Dr. Sachin Kedekarji told you that in new MSc, UG MSc, according to NCSM, 10, 15, 20 or 25 specimens are required for intake capacity of 60, 100, 150 and 200 students. So in the future, it is a basic requirement in our departments. Plastination was invented by
सर पीपीटी चेंज नहीं हो रहा है.
still not. Is it changing?
Yes.
Is it changing?
Yes.
Okay. Sorry. Plastination was invented by Dr. Gunther von Hagens in 1978 at Heidelberg University, Germany. This is the setup of von Hagens, and this is the inside view of its museum. The basic principle of plastination is to remove the water and lipid from the tissues. These two contents are responsible for decomposition of tissues. So plastination, in this plastination technique, they will remove water and lipid from the tissues, and replace these contents with plastic resin. This process is a teamwork and it needs lots of patience. So it keeps some it takes some times. So don't be hurry. If you go slowly, you will win the race. It has been successfully performed with diverse polymer, each offering unique properties and benefits. Some polymers we are mostly using in plastination. These are epoxy resin, silicone rubber, and polyester. Von Hagens use these techniques in the name of E12 technique, S10 technique, P14 techniques. So these are the techniques basically which type of resin they were using. They gave the name. Basically, epoxy resin is a transparent material, so it is used for sheet plastination. Silicone resin, it is translucent and it is a rubber type material, so it is used for luminal plastination, and polyester is used for soft tissue preservation like brain. Now these are the three resins and their advantage and disadvantage. First, epoxy resin. Epoxy resin, we will get two bottles, one resin and other is hardener, and both are very important. Without the mixing of hardener, we cannot prepare sheet plastic, prepare a specimen for this resin. Advantage of this resin is that it is a strong bond material, durable, versatile, and resistant with alcohol and other type of chemicals. Disadvantage of epoxy: long curing time. It will take 2 to 3 days. Sometimes it will take 2 to 3 days or more. Sticky appearance. If it is not mixed properly, it will create sticky appearance and your specimen will destroy it. And it's harmful if inhaled. So expensive, but in silicone resin, compared to epoxy, it is less expensive. It is high temperature resistance, water resistant, weather resistant, and it is resistant to formaldehyde also. Silicone have some disadvantage: less transparent, low tearing strength. It cannot enter narrow lumen because it is so concentrated, so it cannot enter inside the narrow lumens, peripheral vessels. Then third one is polyester resin. We are using for soft tissues. It is least expensive, easy to use, best for UV resistance, and control cure rate easily. But it is a weak bonding property. It have short shelf life and poor stretch quality. So these are the advantage of and disadvantage of these polymers. Now, general principle of plastination, general procedures of plastination. So general procedures are that first we have to fix the specimen. We have to select the specimen first, then fix it with formalin or formaldehyde. But concentration of formaldehyde should be less, not as we are preserving specimen in our museum. It should be less, 10% or less, and it should be exposed less days, to 1 or 2 days maximum, so that we can get a natural type of specimen. So first, formaldehyde preserved specimen or fix the specimen in formaldehyde, then remove the formaldehyde and add the acetone in the tissue, then remove the acetone, add the resin. In this process, this is a basic step of plastinate, and at least the resin insert the tissues and tissue will preserved properly or plastinated properly. So the general procedure of plastination is the formaldehyde fixed material used for plastination. Remove the formaldehyde using running tap water. It will take 1 to 2 days so that the form of formaldehyde reduced, and then clean the material, either hollow if we are using cast for lumen casting plastination, or we are using the material for sheet plastination. We have to clean first. We remove the waste material from the tissues, and we remove the soft tissues, sheets, fascias from the soft tissues, so that we can get a clean and clear material for plastination. Then for hard tissue, if we are using hard tissue for plastination, like miniature bones, ear ossicles, then other type of bones, first we have to bleach after cleaning. We have to bleach using H2O2, which is 5 to 8%, and dip these hard tissues for 24 hours. This specific method is crucial for the preservation of these type of tissue. It create natural color of these hard tissues. Bone will become white. It will become white. Otherwise, it will it will appearing pale and brownish color. So, for natural appearance, bleaching is must for hard tissues. For soft tissue cleaning, use underwater dissection. It is essential because fascias and other soft tissues fibers are attached on the soft tissues, so we have to remove, and without the underwater dissection it is not possible to remove all the fascias. Then water, to remove water and lipid, dip this tissue in acetone, which is 98% concentration, and the quantity of acetone we will use, it is 10 times of the total body weight of tissue. What type of tissue we are using? Suppose we are using bone, we are using a slice of brain, we are using a slice of kidney, or any other type of material. First we have to measure its weight, and then 10 times acetone, 98% concentration as concentrated acetone you will use for removing the water and fat. Due to this procedure, this is called dehydration. So this procedure will perform under the temperature of 25 degrees minus 25 degrees centigrade. This is called acetone bath. So for soft tissue preservation, we will take 1, 2, 3 types acetone bath. Okay. After 3 acetone bath, or after completing of third acetone bath, we will measure the color or concentration of acetone. If the color remain yellow, then we will again do this procedure. And if we get the natural color of acetone after third acetone bath, it means now the liquid and fat has been removed totally from the tissue. And if it not, then we will go for further acetone bath. But in general, 2-3 acetone baths are sufficient for dehydration. And this complete procedure will take 18 days. Every acetone bath takes 6 days. So 18 days are essential for acetone bath or dehydration. Then dry the material for some time at room temperature. Then force impregnation of tissue. Suppose we are performing luminal cast plastination, we are performing sheath plastination, we are performing organ plastination. So at this time, first we will select the resin, then apply the method of resin, insert the resin, pouring inside the tissue, and then use curing agent. And after curing, this material will harden and we can display it in our departmental museum. So these are the basic steps. These are the basic steps for plastination. Generally, three type of plastination we are performing: luminal cast plastination, sheath plastination, and organ plastination or whole body plastination. Luminal cast plastination, it is just like preparing a model with the help of a cast. So it is called luminal cast plastination. We are using a lumen, pour some resin and a tissue like vessels or trachea and any other type of tissue what we are using as a cast material, and we get the plastinated vasculature or arrangement of that structure. It is done for hollow organ like lung, stomach, intestine, ventricles of brain, vascular pattern of heart, and kidney. Beautiful pattern of bronchial tree can be seen by this technique. Luminal cast plastination is not a tissue plastination. It is basically a resin casting method because we remove all the tissue after preparation of resin casting. As we will see our in next slide. So it is not a tissue preservation method, but it is an important method for studying vascular pattern and internal structures of hollow organ. These tools we are using for luminal cast plastination: IV needles, depending upon the lumen size, what type of cast we are using, what size of lumen. So according to the size of lumen, we can use these type of IV needles. Then we can use 5 ml or 10 ml syringe. Basically, these are using for epoxy resin plastination, epoxy resin type of luminal cast plastination. And the third one is the silicone plastination. This is a gun and the tube for luminal cast plastination. So epoxy and silicone, both resins can be used for luminal cast plastination. Problem is that, as we have discussed previously, that silicone resin is concentrated and it cannot enter narrow lumens. So for narrow lumen like vasculature of kidney, vasculature of other structures, we are using epoxy resin because it is so liquid and it can enter minor structures also. Method of luminal cast plastination. First, cast selection. What cast you are using? Whole organ like stomach, duodenum, trachea, etc. Blood vessels, including thoracic duct, abdominal aorta, renal vessels, ventricles of brain. What type of cast you are using? Then cleaning and clamping. Clean the cast properly with running tap water or with pressure of water with the help of syringe. Cleaning is must. I am again telling cleaning is must. Without cleaning, we cannot get such type of structure that we want. For example, if we are using blood vessels, clotting are inserted here, blood clots are there. Sometimes uh, it will torn, it will uh, tear. So clean properly with water, running tap water, or with the help of syringe, so we can assure that all the passage has been cleared and now our cast is clear to, for the resin. Then clamping, it is again essential step. Clamping all the unwanted parts, clamping the minor openings, clamping the tearing parts of this cast so that we can prevent the wastage of resin. Now, resin selection, as we have told you, two type of resin we are using. If we are dealing with minor vessels with that have narrow lumens, that have narrow passage, we are using epoxy. Like if we are try to preserve the renal vasculature, we are using epoxy resin. It have an advantage that we can add some color in epoxy resin, so we can get different type of vasculature in different colors. And epoxy and hardener we are using in 2:1 ratio and uh, mix with each other and applying with the help of syringe and IV set. In the case of silicone, so if we are uh, casting, we are using tracheobronchial tree for casting, luminal casting, so we can use silicone resin, silicone rubber. And as we have seen, it have a tube and a gun. With the help of gun with trigger and pour the resin which have large lumen and easily get the plastinated vasculature. Now, after pouring remove the cast and clean it and then mount it on a glass or fiber sheet with proper labeling. Now, these are the steps which we have discussed: cleaning, clamping, pouring the material inside the abdominal aorta. This is the luminal cast plastination which we have performed in our department. One of our PG scholar, Dr. Monica, performed this luminal cast plastination under the supervision of Dr. Satishwat sir and me. Then remove the casting and mounting on a glass sheet with proper labeling. These are the examples of silicone resin plastination. This is the tracheobronchial tree, and yes, this is the luminal cast plastination of epoxy resin. And as we have discussed that you can use color in it, so these have some veins and arterial arrangement which we preserve in our department. These are the renal vasculature system. Now these are some videos that shows the process of plastination. First, cleaning the cast. Select the cast. It is popliteal artery. One of our scholar, Dr. Hariom, cleaning it with the help of syringe and water. This is again clamping and pouring the resin. Dr. Varun and Dr. Hariom performing this. As it going, it will take some time. So don't be hurry and push the material so that it can easily insert. And after it, we have removed the cast and get our vasculature properly. Get the vasculature properly. As you can see here, this is the popliteal artery, vasculature, plastinated popliteal artery. So these are the procedure of luminal cast plastination. Now, second one is sheath plastination. It involves making thin, transparent, or thick, opaque section of the body or an organ. This portable sheath display cross-sectional anatomy comparable to CT or MRI scan sections. Sheath can be made in various plane. You can get horizontal, you can get transverse section, you can get oblique section. What type of section you want, you can get this type of sheath plastination. You can get this specimen and prepare it as a sheath plastination. Use it as a sheath plastination. Thin section is necessary. Generally, we are cutting 2 to 3 mm sections, and we can get less than 2 mm sections also for sheath plastination. It depends on your that what thickness you are choosing. Less thin tissue create less more shrinkage of tissue. So 2 to 3 mm, according to my experience, 2 to 3 mm section is sufficient. Some miniature bones, these are the soft tissue preservation, but some miniature bones like ear ossicles or teeth can also be preserved for demonstration. Epoxy, polyester, or polypropylene resin, these are the preferable of resins for sheath plastination. Now, this flow chart showing the procedure of sheath plastination. First, specimen selection. then freezing it with or without wax uh, uh, at -20 or 80 degrees centigrade. Then cut the slice 2 to 3 mm or less than 2 mm. We are using two type of saw here. Generally, we are using sharp bend saw, which get 2 to 3 mm slice, and for less thick slice, we are using diamond blade saw, which have no tooth. So after cutting, dehydrate this procedure, remove the water and lipid with the help of acetone, that is 90 to 100% at -25 degrees centigrade. This is we have called acetone bath. Take 2 to 3 acetone bath. Then examine it after third bath, whether it is whether acetone get yellow colored or whether acetone have 98% concentrate or 100% concentrate or not. After third bath, we can get our tissue properly dehydrate and properly defatting, fat-free tissue. Now, for some time at the room temperature, again dip the tissue in acetone. It will take 1 to 2 days. Then remove it from the acetone and insert in resin. What kind of resin you are using? Epoxy or silicone or polyester resin? What kind of resin you are using? It depends on you. So use the resin, insert the tissue in the resin and impregnate or forcefully insert the resin with the help of vacuum chamber. There is a material, there is a vacuum chamber and vacuum pump available on the market that we can use for impregnation, resin impregnation. The pressure of resin impregnation at the time of resin impregnation is mostly -20 INHG or up to -5 INHG, or we can say 760 to 30 mmHg. Both are measuring on the pressure gauge that is situated on the top of the vacuum chamber. Now, when this procedure will complete, how we can assure that when acetone with the help of vacuum chamber, when we pour the resin, acetone will came out and it will appear on the surface like a bubble. So when bubbling came out on the surface of the resin, it means acetone coming out and resin getting inside the tissue. And if the bubbling will stop, then we can say that acetone will completely removed and that tissue will get most of resin. So now it is this procedure has been completed. After this procedure, we remove the tissue and going for the next step, that is curing or hardening. Use some hardener. If we are using epoxy, we can get epoxy and hardener mix material, that is 4:1 ratio. Mix it and apply on it. Then we can get our material or a hard specimen. And if we are using silicone, we can get S6 material, that is a liquid material using for hardener, and it will evaporate in air. So with the help of this hardener, we can create the hardening in our specimen and get the plastinated tissue or sheet. Another procedure is that we can create a cast. We can create a cast with the help of uh, acrylic sheet and create a layer first, then apply a specimen on this first layer after 24 hours, because after 24 hours it will become hard. Then apply our specimen on it, and then again pour the second layer over the specimen, so that we can get a complete slice of specimen, plastinated specimen. This is called sandwich method. So for the beginners, sandwich method is very better, very good for sheet plastination. Some key points to be noted here: that clean the specimen through underwater dissection properly, measure the size and shape of specimen during sheet plastination, measure the weight of this specimen so that we can assure the shrinkage. Long-term freezing of tissue create shrinkage, more shrinkage, so be careful about that. Dehydration and defatting, or we can say acetone bath, are essential step for preventing tissue shrinkage. Without these procedure, we cannot get exact structure what we want. Now, less than 10% shrinkage can be acceptable, but more than 10% is not acceptable. Use sharp blade or diamond band saw for thin or ultra thin cutting, as we have discussed, 2 to 3 mm for sharp blade and less than 2 mm for diamond band saw. Use a cast according to the thickness of the tissue size if we are using sandwich method for sheet plastination. These are the plastinated material, plastinated sheet for transfer section of body of different level. We can also perform the complete plastination of an or part of the body and then slice it with the help of saw, or we can cut the section and then slice it. What you want, what you can do, what according to your suitability. It depends on your suitability. These are the horizontal slice of brain and longitudinal section of head. We are performing sheet plastination with ear ossicles. So these are the two sheet plastinated ear ossicles. Anatomical arrangement of ear ossicle and ear ossicles, and mount it, labeled it properly, and now they are using as a paperweight. This is the second example of sheet plastination, and this is organ plastination also. This is the example of organ plastination also. Here we are plastinate first this soft. This is the transverse section of uterus. First we plastinated it according to the organ plastination procedure. Then again create a sandwich mesh sheet plastination so that we can get this type of final plastination of transverse section of uterus. Here you can see we have labeled it and we displayed it in our museum. Before the plastination, it looks like this, and after the plastination, it looks like this, because it become black because we are using here epoxy resin, and this is the disadvantage of epoxy resin, that it create blackness of tissue. So Third one is uh, brain sectioning. Again, we will create a section of brain, then give acetone bath, then resin bath, and then we will create a sandwich method for preserving the brain slice. There is some shrinkage we will find, but at the end we get the sheath plastinated slice of transverse section of brain. Now this video shows the procedure of sheath plastination of ear ossicles. Let me show you. First, we are using epoxy resin. These are ear ossicles, Malleus, incus, and stapes. We are using two type of material. Epoxy, one bottle shows A and another shows B. B is harder and A bottle have the epoxy resin. We have mixing it in 2:1 ratio, 2 part epoxy and 1 part hardener. We are mixing it. It will take 3 to 5 minutes because when we are mixing it, it creates some bubbles, air bubbles. And if we do not properly mix and do not mix it for 3 to 4 minutes, it will create bubbles, and these bubbles create a false appearance on your specimen. So properly mix and remove all property so that we can get a transparent, a fresh specimen. So this is the mixing process. Now we are using a cast and creating a layer and leave it for some time. It will take around 24 hours for fixing. So after 24 hours, we will add our material on it and then again pouring epoxy mixed with hardener so that the material will insert between these two layers. This is the sandwich method of sheath plastination. So hard material or soft material, what you want, you can plastinate with the help of this sandwich method. This is the second day. We have added our specimen. We arrange ear ossicles in anatomical position. Now we will pouring second layer on it. Yes, again the same procedure we will follow. Epoxy resin mixed with hardener, mix it properly, remove the air bubbles, and then pour the resin on the material. Now it will clear, crystal clear, and all the bubbles have been removed. Now I am pouring the material, resin on the material. Be careful, it will not disturb your arrangement. Don't don't create too thick cast because it is a wasting of material. So depending on the thickness of your specimen, use the cast and the material so that the thickness of specimen cannot came out the material. Now the third day it will fixed and prepared. Now we are removing the cast and we will get the specimen. Yes. Now this is the specimen, sheet plastinated hierosicles, and this is the 3D view, and it is clear from all side. Some parts needed to be cleaning and finishing, but now it is ready for mounting and labeling, and we will use it as a paperweight in our table also. So this is the complete arrangement of complete procedure of sheet plastination. Now organ plastination. In this process, the entire body or an organ is plastinated. Total structure and relationship of an organ are preserved. As you can see here, these are the example from Von Hagen's museum. Two plastinated body of rugby players. They have preserved whole bodies. These are the example of comparative anatomy. Smoker and non-smoker lungs. Plastinated specimens. So we can use it for the education of students and the patients also. Now the method of organ plastination. Again, these 4 steps: fixation, dehydration, fixation with formaldehyde or formalin, dehydration with acetone, impregnation with resin, curing with art. Fixation will take 1 to 2 days. We will use 10% formaldehyde solution for fixation. Minimum fixation approach using a low percentage of formalin and a short duration can produce a more flexible and natural looking specimen. Now dehydration, it will take 3 to 4 weeks, as we have discussed that 18 days acetone bath or 3 acetone bath are essential for every tissue dehydration. It will depend the fat content and the water content in the tissue that it will take less time or more time. In this step, tissue fluid is replaced with an organic solvent, what is called acetone. First, the specimen, formalin fixed specimen, are washed in running tap water for 2 days to neutralize the formalin fumes. Then water and lipid were removed with the help of acetone, that is 98% or 100% sometimes, at minus 25 degrees centigrade temperature, and take 2 to 3 acetone baths 6 day 6 days interval. Now the specimen were turned at least once a day to ensure the maximum acetone action of acetone on the specimen. Acetone turn yellow after 6 days, then replace it until we can get the natural color of acetone, or we can use acetonometer to measure the concentration of acetone. If after third day we can get, or after, sorry, if we can get 98% concentration after third acetone bath, it indicate that our dehydration step has been completed. Now the specimen is completely liquid free and fat free. Now acetone will remove with the help of resin impregnation. At this stage, again I am saying that 10 times volume of tissue, 10 times volume of tissue acetone, which have 98% concentration, can be used for dehydration. These are acetonometers which we can use for, these are looks like a lactometers to measure the concentration of acetones. We are performing 6-month fetus skeleton for organ plastination, and this is a procedure which we will follow. We have followed acetone bath. After acetone bath, third acetone bath, we can get this type of arrangement of the specimen. And what is the procedure, we will discuss in next slide. Acetone bath, what happened during acetone bath? Minus 25 degree temperature, acetone remove the water contents and fat contents from the tissue. Then force impregnation. This is the third step. Now acetone will remove and we will insert the resin with the help of vacuum. So for this purpose, we will use vacuum chamber. Thanks to university, we will get, or sorry, we have got these type of instrument in our department so that we can perform organ plastination. Vacuum chamber, motor and pressure monitor. This is a basic central step of organ plastination, or main step of organ plastination. Where the intermediate solvent is replaced with a curable polymer such as silicone, epoxy resin or polyester resin. If we are using soft tissue, we can use silicone or polyester resin. If we are using hard tissue, we can use epoxy. Sometimes for hard tissues, we are using silicone resin. for smoothing of this tissue. The dehydrated specimen is placed in a bath containing liquid polymer or resin bath. After a specific immersion period, a vacuum -20 is applied to the specimen and gradually reduced it up to the -5 ING. We will properly washed. First day we will apply -20 ING, then -10. It will depends on the tissue and it will depends on the size of the tissue. Suppose we are using a small tissue or slice of a tissue, we will applying and watching every 3 to 4 hours, 6 hours. And if we are using larger tissue like liver and such heart, such type of organ, so we can watch after, we will watch after 12 hours, so that it will properly, resin will properly insert inside the material or specimen. A clean visual view of the completion of impregnation is when the bubbles that are coming on the resin surface ceased. As we have told you that acetone will came out in the form of air bubbles. So when it will cease, it means it indicating that impregnation process is finished. This is the process of impregnation which we have performed on fetal skeleton. So after impregnation, bubble is bubble will cease. It looks like this, bubbling appearing on the surface like this. And when the bubble will cease, it is the sign that our impregnation process has been completed. And acetone will remove through these bubbles and the resin will insert inside the tissue. Now the fourth step is hardening or curing. So if we are using silicone, we can use S6 silicone for hardener, and it is a liquid material, and air, with the contact of air, it will create more effect on the surface of the tissue and the tissue become harder. This is a process of hardening. This is the chamber. We don't have this type of chamber because still we are not using silicone resin for organ plastination. We are performing with the help of epoxy resin. So the procedure is different. But if you are using silicone resin, you can also use this type of material, this type of instrument for hardening. This is the chamber, glass jar for curing material, and this is the tube, and there is a pump which create air, and air get inside the material and create vacuum vapors, and these gas vapors came out and uh, contact with the material, and then the material become harder. This is the process of curing. Impregnated specimen and a bowel fixed with curing agent are placed in a tightly closed chamber for several weeks. This achieved by exposing the impregnated specimen to a hardener, which can be liquid or gaseous, that vaporize at room temperature and causes faster curing. Finally, the polymer inside the specimen had to be cured. For complete curing, the specimen should be kept in a plastic bag for weeks, 7 days or 14 days after curing. Before curing, you will place in the bag, it will attach with the bag and your specimen will destroy. So after curing, you will keep in a bag for some time. We are performing with epoxy resin, so we are using the mixture resin-based hardener in 4:1 ratio. After impregnation, we will apply a coat on specimen, one coat and two coat, so that we will get the harder specimen. This is the procedure of organ plastination of uterus. It shows plastinated uterus after third stone bath. Now we are performing the. This uh, picture shows the procedure after third stone bath, and now we are getting it inside the vacuum chamber. We are putting it inside the vacuum chamber, and we are pouring the epoxy resin in it. So after impregnation, you can see in second picture, this is the size and shape of uterus, and the tissue reduction is less than 10%. So after curing, after removing the resin, we will apply one or two coat on this complete material in 1:4 ratio of epoxy and its hardener. And after completion of hardening or curing, we will get this type of specimen. So this is the example of organ plastination with the help of epoxy resin. This is another example of organ plastination or heart tissue bone plastination. First, we will dissect the specimen, underwater dissection, then remove all the soft tissues. The aim is to expose the bone of this specimen, bony framework. Then we will give first acetone bath, then second acetone bath, because this is a bony material and less fatty material is there, less fatty material is there. So after second acetone bath, we feel that this material become more dry and become more black. So after it, we will we poured it in H2O2, hydrogen peroxide, for 24 hours, so that its blackness will remove and the tissue become soft. Now after H2O2 bath for 24 hours, we remove this skeleton and dip into resin, epoxy resin, or resin bath. So after resin bath and after impregnation, with the help of vacuum, we got this type of plastinated skeleton. Then we apply 1 or 2 coat on the skeleton, and now we are using this skeleton in our department. We can see the complete arrangement here. If you can see, the heart and the lung are properly intact here. Brain is attached in this specimen, and all the bones of upper limb, lower limb are properly attached here. So this is the process of organ plastination.
ठीक
Now,
ठीक
at the end,
बस
what are the use of plastinated specimens? So the plastinated specimens are proper dye tissue specimen for long-term preservation. It is a safe, durable, and hazardless actual tissue plastinate plastic models that can be prepared to educate the students and patients also. Actual 3D models for anatomy teaching and training, museum display of historically essential materials. Plastination can use for the preserving autopsy or surgical tissue specimen for teaching and training purpose and histological examination. As patient educative tools, we can use plastinate materials, explain a pathological or pathological material of the patient with its surface from using a plastinated specimen of such an anomaly or pathology. Then preserving whole organisms such as insects, parasites, snakes, snake, plants in toxicology department, Agatantra department, in Dravgun department. It can be used for forensic science, for documentation of evidences. As every procedures have some advantage, same as it also have some disadvantage. So plastination have some disadvantage, like it is technique sensitive. If we lose some technique or if we do not follow the proper procedures, we cannot get the proper specimen. Tissue will shrink, material will shrink, or we can waste the material, resin, and cannot get the proper structure or proper specimen that we want. So it is a technique specific. Use proper technique, follow proper technique, follow proper to get the best specimen. As I told you previously, patience and teamwork is must during performing these procedures. Third one is careful resin selection is essential. If we are using a brand specific resin, so we can mix the same brand specific hardener in it. Don't use any type of hardener with any type of epoxy resin. It will waste your material. This is our experience. It will waste your material. Or if we are choosing some specimen and applying on it, so be careful what type of specimen you are using and what type of resin you are performing on it. If we are performing, suppose if we are performing epoxy resin on hard tissues, epoxy create blackness on hard tissue. So before selecting the resin. Tissue may be shrink or damaged if you are not follow the proper procedures. So, and last, beginners have to do lot of trials and errors. And at the end of this lecture, I must say slow and steady. Slow and steady. This is the main motto of this procedure. Then you can win the race. If you will go hurry, if you will create hurry, you cannot get the specimen and total your total procedure will waste.